Three. Hi, everybody. Noel O'Neill here from the Ayurveda Centre. So I'm just here today with Dr. Rajvinder Kaur. Dr. Rajvinder is an Ayurvedic doctor. In India, that would be called a Vaidya, but an Ayurvedic doctor. So that means she has a BAMS degree. So we're just going to have a little chat with Dr. Rajvinder this morning. So maybe, Dr. Rajvinder, you could tell us a little bit about the education, about the BAMS degree.
Okay, thanks, Noel. BMS is Bachelor of Ayurvedic Medicine and Surgery. So it's about like 5.5 to 6 year degree program. And I studied Shri Krishna College and Research Center in Kurukshetra. It's a place near Delhi. And during your study, you have modules like you are studying physiology, anatomy, pathology, the Western medicine, and also your Ayurvedic medicine model. And your 1 year internship program where you do 6 months in the medical hospital and 6 months in the Ayurvedic hospital. So you have very kind of intense training to understand the how human system work, and you do have training in the Western medicine, but not as depth as a medical doctor would. You're more trained into the Ayurvedic side. So that's what it involves.
Okay. And then, I know you practice in Dublin. I know you travel around the place as well, but, typically what sort of patients are you seeing or what type of people come to visit you?
Because Ayurveda is a prevention model. Ayurveda principle is to protect the health of a healthy person and restore any imbalance if there is. So you're looking at an individual when they present with you, let's say, different kind of problem, mental health issue, digestive problems, a woman's around hormonal problem around their cycle or menopause, skin issues. So first you're looking at the individual, what kind of personality they are, because Ayurveda is a very individual approach. So holistically, it will treat almost any kind of imbalance that's there. So you talk to the person for 1 hour and find the root cause of their problem. Sometimes it's a simple little tweak in their daily routine, like bedtime, or little change it in their diet, maybe a air type of body, air personality is eating too much of cold food. So with Ayurveda principle, you change a little bit of their eating habits, and you try to restore the balance. So I would see almost any kind of patient with which issue that a normal GP would see, but the Ayurveda approach will be different from traditional practice. Yeah.
Okay, so what my understanding is from an Ayurvedic approach, like disease is seen in terms of imbalance. Well, it's kind of in the word disease because it's disease. So what you're trying to do is figure out what that person is doing or what they're eating or what they're not eating or what way they're living incorrectly and trying to adjust their lifestyle and then, hoping that that has a kick-on
Yes.
effect to help with the
Yes.
particular condition
Yeah.
that they have.
My
Yeah.
my big focus in my consultations is on their diet. And I also run like Ayurveda nutrition and cooking demonstration workshop, which people learn a lot. So as you know, we are what we eat. So Ayurveda approaches a lot on if you can restore their eating habits and then a little bit of daily routine recommendation in their lifestyle. Because Ayurveda deal with a lot of chronic lifestyle problems like cholesterol, diabetes, weight management. And then Ayurveda say your digestion is the key to your health. So yeah, so diet will be a big part.
Okay, so I'm just going to share my screen, Dr. Rajvinder. I just want to let people know where they can find out some more information on this. Uh, and how they can get in touch with you. So you can see over here that our web address is ayurveda.ie, just ayurveda.ie. And if I go to I just go to the homepage of that site, ayurveda.ie, they can see your contact details there. That word Vaidya, you'll see it in front of many of the doctors there. Vaidya means Ayurvedic doctor. It's not their first name or anything like that. It just means Ayurvedic doctor. And then obviously up here we have Dr. Brennan, who's a Western trained a medical doctor as well as Ayurvedic doctor. So Vaidya Rajvinder lives in Lucan in County Dublin, and you can see her email address there and her phone number as well. Now she does lots of online consultations. She also travels quite a lot, so she goes to the UK a lot, and I know she comes to my hometown in Drogheda and Wicklow and various different places around the country as well. So you can get in touch with Dr. Rajvinder if you want to speak to her there. If you want to find out more about Ayurveda, we have a free 7 lesson course on our website here. This is a course that we developed during COVID. It's a really, really good 7 lesson course. It will give you a really deep understanding of Ayurveda and Ayurvedic principles, and it'll do a lot for your health, even without even seeing a Vaidya. Just the knowledge alone will give you lots of lifestyle tips and dietary tips. and we've some great testimonials there from various doctors and different people. So for that, you can register for that on our website. Also on our website, we've lots of webinars. We've done webinars on different conditions. So you can see there we have brain health, which is mainly to do with dementia and Alzheimer's disease, but we also have arthritis, anxiety, psoriasis, sinusitis, tinnitus, and like lots and lots of different free webinars. And all of these will be based around diet, lifestyle, herbal preparations, purification, detoxification techniques. So you can download any of those webinars. They're all free. You just have to register for them, and they're free. And we are also, yeah, so that's where you can get all the information on Dr. Rajvinder. And as I say, Dr. Rajvinder travels to the UK quite frequently and all around Dublin. She does personal consultations from her centre in Lucan, and also online consultations as well. So is there anything else you'd like to add, Dr. Rajvinder?
No, I highly recommend that self-care course if people haven't done that. That give a very good understanding because Ayurveda is a new growing concept in Ireland. It's very well established now. Like I came back in 2007, and if I compare now to 2025, it's gone a long way ahead. People understand it, but still, it might be a new concept for people. So, highly recommend that self-care course, which is totally free, and there's a lot of knowledge there. And you can do a lot learn from the self-care course and do a lot yourself. But then if there's anything, yeah, do see a Elijah and they can help you further.
Yeah, I'd have to definitely agree with that. I've been working in this area for nearly 30 years now with Dr. Brennan and yourself and the other Viages, and there has been massive growth in the awareness and the openness to Ayurveda
Yeah.
in the last 5 years. Really, we've seen really sustained growth. Okay, Dr. Rajvinder, thanks very much for coming on and doing that little interview with us. So thank you very
Thank
much, and
you.
I hope everybody listening to this got some useful
Yes.
information from
Thank
it.
you.
Thank you. Bye
Thank
bye.
you.